When patients walk into a hospital, they may not understand clinical outcomes or quality metrics. But they immediately notice one thing. Is this hospital clean? That first impression shapes confidence, trust, and ultimately the patient's entire perception of care. For healthcare leaders, cleanliness is no longer simply an environmental services responsibility. It's a strategic driver of patient experience, safety, reputation, and financial performance. In today's healthcare environment, organizations are judged through publicly reported CMS patient experience scores, leapfrog safety grades, Becker's hospital review rankings, and sustainability benchmarks. So the question becomes, how do leading hospitals consistently outperform their peers? In this video, we'll explore how TouchPoint Support Services helped hospitals earn national recognition for cleanliness, patient experience, safety, and sustainability, and what every healthcare organization can learn from their approach. Hospital leaders face enormous pressure. Patients expect exceptional care. Regulators demand accountability. Margins continue to tighten. Staff shortages remain a daily reality. Meanwhile, public reporting makes hospital performance more visible than ever before. According to CMS HCAHPS data, the national average patient rating for hospital cleanliness is approximately 74%. Top-performing hospitals achieve scores around 85%. That 11-point difference represents far more than cleaner patient rooms. It reflects operational consistency, leadership engagement, frontline accountability, and an organizational culture committed to excellence. Healthcare organizations can no longer afford to view environmental services as simply maintaining facilities. Today's most successful hospitals recognize EVS as an essential contributor to patient experience, infection prevention, operational efficiency, and organizational reputation. Research continues to reinforce what healthcare leaders already suspect. Patient perceptions of cleanliness directly influence overall hospital ratings, likelihood to recommend, trust in the organization, and even perceptions of clinical quality. Studies also demonstrate that hospitals receiving higher cleanliness ratings tend to have lower hospital-acquired infection scores, making operational excellence an important contributor to patient safety as well as patient satisfaction. When hospitals improve cleanliness, they aren't simply improving survey scores, they're strengthening confidence in every aspect of care. That's why organizations recognized by Becker's Hospital Review, Leapfrog, and Practice Green Health have become industry benchmarks. These recognitions tell patients, employees, and communities that operational excellence isn't an initiative, it's part of the culture. So what separates hospitals that consistently earn national recognition? It starts with partnership. TouchPoint works alongside nursing leaders, executive leadership, infection prevention teams, and frontline caregivers, not as an outside contractor, but as an integrated member of the healthcare team. One regional operations leader described the relationship perfectly. The hospital doesn't consider us a purchase service or a contractor, they look at us as part of the family. That collaborative philosophy translates into disciplined daily operations. Managers conduct routine leadership rounds. Quality assurance testing verifies cleaning effectiveness. Patient feedback is monitored continuously. Room turnaround times are measured in real time. Staff receive ongoing coaching and training. Patient-centered communication using AIDET creates stronger interactions between environmental services associates and patients. Rather than waiting for problems to appear, teams identify opportunities early, correct issues immediately, and create a culture of continuous improvement. It's a proactive model instead of a reactive one, and that's where lasting operational excellence begins. Operational excellence should always produce measurable outcomes, and TouchPoint's results demonstrate exactly that. Across supported hospitals, 44 client hospitals earned 2025 Practice Green Health recognition. 5 hospitals were recognized among Becker's Hospital Review's cleanest hospitals. TouchPoint supported facilities consistently maintained A Leapfrog hospital safety grades. Operational improvements were equally impressive. One Michigan health system reduced room turnaround times by nearly 33% while achieving an extraordinary 99.7% task completion rate through integrated workflow management. Across 5 acute care hospitals, performance excellence initiatives produced a 10.9% year-over-year increase in cleanliness scores. Even more compelling, TouchPoint's quality assurance platform demonstrated a 99.9% statistical confidence linking stronger quality assurance performance with improved patient satisfaction. These aren't isolated improvements. They're measurable evidence that disciplined operations directly influence patient experience. The most successful hospitals understand something important. Patients don't separate environmental services from clinical care. To patients, everything is healthcare. Every interaction matters, every room matters, every employee shapes their perception of the organization. TouchPoint helps hospitals create cultures where frontline associates understand that their work contributes directly to healing. Housekeepers become ambassadors for patient experience. Leaders celebrate patient compliments. Teams recognize exceptional service. Accountability becomes shared rather than assigned. One hospital in Kansas used AI-DET communication practices to improve patient engagement while maintaining repeated Becker's cleanest hospital recognition and consistent Leapfrog A safety grades. That's the difference between managing a department and building a culture. Today's healthcare leaders are also expected to improve environmental stewardship. Hospitals generate enormous amounts of waste while consuming significant energy resources. TouchPoint helps healthcare organizations transform sustainability into measurable operational value. Programs include food waste diversion, environmental stewardship initiatives, energy efficiency improvements, real-time building management systems. These efforts have contributed to dozens of practice, green health recognitions, and even a Texas Environmental Excellence Award for innovative operations. Operational excellence today isn't just about what happens inside the patient room. It's about building healthier communities and more sustainable healthcare systems. Recognition doesn't happen by accident. It is earned through consistent leadership, operational discipline, frontline engagement, data-driven accountability, and strong partnerships. Whether your organization is focused on improving HCAHPS scores, reducing infection risk, strengthening hospital reputation, or earning national recognition, the foundation remains the same. Operational excellence creates exceptional patient experiences, and exceptional patient experiences create stronger healthcare organizations. If you're looking to improve environmental services performance, elevate patient satisfaction, strengthen quality assurance, and position your healthcare system among the nation's leaders, TouchPoint Support Services can help. Visit TouchPointSupportServices.com to learn how operational excellence can become your organization's competitive advantage.